How do you find mental health help in remote, post-disaster areas? Imagine being in a place where help seems out of reach and your feelings of stress or grief feel overwhelming. After a disaster, many people in remote areas face this challenge. But help is still available, and there are ways to connect with mental health support even when local services are limited. First, telemedicine or telebehavioral health services are a game changer. These platforms let you talk to licensed mental health professionals through video calls, phone, or even text. Many health providers have set up these services specifically for disaster situations. They can offer crisis counseling, therapy, or psychiatric consultations without needing to travel. Emergency plans often include these options to keep support accessible when roads or clinics are damaged. Next, community-based approaches are vital. Training local community members or trusted leaders in psychological first aid allows them to provide immediate emotional support. These individuals can listen, offer comfort, and guide others to further help. This method respects local cultures and helps reach people who might hesitate to seek formal mental health care. Volunteer organizations like the American Red Cross also play a big role. They send trained mental health volunteers to disaster zones. These volunteers include licensed counselors, social workers, and nurses with mental health experience. They set up support stations in shelters or community centers and do outreach in remote areas. Their presence helps people feel less alone and more understood during tough times. Many countries have national or local crisis hotlines that operate 24 hours a day. These hotlines are often multilingual and free to call. They provide immediate emotional support and can connect callers to local resources if available. Mobile apps designed for disaster mental health are also useful. They offer self-care tips, coping strategies, and quick access to help. These apps can be downloaded beforehand and used when needed. Coordination between emergency management teams and mental health agencies is crucial. When planning disaster responses, they include mental health services as a key part of recovery. This way, even in remote areas, mental health support is integrated into the overall response effort. Addressing stigma is also important. In some rural or isolated communities, people may hesitate to seek help because of cultural beliefs or fears. Emergency preparedness should include culturally sensitive outreach and education to normalize emotional support and encourage people to reach out. Finally, supporting home-based care providers is essential. These caregivers often face increased stress during disasters. Providing them with mental health resources and training helps them stay resilient and better support their families and neighbors. In summary, finding mental health help in remote, post-disaster areas involves using technology like telehealth, training local helpers, deploying volunteer professionals, and ensuring hotlines and mobile resources are available. Planning ahead and working together makes it possible to reach those in need, helping communities recover emotionally after a disaster.